Good day, everyone. This report is all about first aid in the workplace, prepared by Rifuya Maria Micaela and Piveda Milrose Abelar. Before we proceed, we need first to understand that the basic first aid for the workplace is an essential component of creating safe environment within your business or organization. When your employees are trained in basic first aid, they will be able to respond quickly and appropriately to a workplace injury or medical condition. First, what is the first aid in the workplace? First aid in the workplace is defined as the necessary temporary assistance an injured person needs until professional medical care can be provided. First aid is not medical care, and it's important to remember that as you go through any kind of first aid training, as well as you provide first aid in the event of an emergency. Next is, what is the purpose of basic first aid training? The purpose of basic first aid training is to prepare you and your coworkers in the event that something does happen in the workplace. Remember, first aid is not a medical treatment, but rather the basic first aid understanding you need to help someone who has been injured in the workplace until a medical professional can provide care. It's also good to note that basic first aid does not take the place of CPR or AED training. If you are looking to learn those skills, it's best to turn to the Philippine Red Cross for professional training. So now that we have a shared understanding of the basic of first aid, let's go over 5 basic first aid tips for the workplace. So we have 5 basic first aid tips for the workplace. First is to understand the primary goals of first aid. As we've mentioned before, first aid is not considered medical treatment. Instead, it is the basic understanding you need to help someone with an injury until a medical professionals can make it to the scene. With that in mind, these are the 3 primary goals of first aid. First, preserve life. Second, prevent further injury, and last is to promote recovery. In the event that there is an injury in the workplace, it is your goal to do what you can to keep that injured person safe and alive so that they can recover quickly after being treated by medical professionals. Number 2, always assess the scene first. No matter what the situation, if you encounter a person who has been injured in the workplace, it is important to assess the scene before you rush to provide first aid. This is the first step of providing basic first aid, and it is very important. Here are a few reminders regarding what you should do to assess the scene. First, you need to survey the scene of danger. Is there any danger in the area around the injured person? If the scene is safe, you can enter to provide first aid. If the scene is dangerous, it's important to assess and eliminate the danger before you rush onto the scene. If the scene is not safe, contact emergency services right away. Next is look for the cause of injury. If it's safe to approach the injured person, do your best to look for the cause of injury. The more you know about how the person was or might have been injured, the more helpful you can be to medical professionals. Next is do not move the injured person. It's important that you do not move the injured person before emergency services arrive. It can be difficult to assess internal injuries, and it's always best to let the professionals determine how best to move the injured person individual. Next is call emergency services or 161. Once you've ensured that the area is safe and you've made it to the injured individual, always call emergency services or 161. If you have a bystander placed to call to emergency services, make sure that they are well informed so the appropriate assistant is dispatched to the scene. Stay on the line unless the operator specially instructs you to hang up. Last is administer basic first aid. If the scene is safe, you are trained and able to administer basic first aid, you should do so at this time. If you're not sure what's wrong with the person, wait with them until emergency services arrive. Do your best to keep the injured person calm by letting them know they are not alone and that help is on the way. Number 3, remember the Good Samaritan law. If you encountered someone in your workplace or even outside your workplace who has been injured, it's important that you help whenever you can. The Good Samaritan law provides legal protection to those who give reasonable assistance to those who have been injured, who are in danger, or who are otherwise incapacitated. If you are using basic first aid to try to help someone who is injured, you are protected by the Good Samaritan law. The law was created so that you don't have to worry about negative repercussions in the event that the injury is serious. Number 4, know the most common medical conditions in the workplace. When it comes to first aid in the workplace, it's always good to know the most common medical conditions that you may have to respond to. If you're familiar with these conditions, you're able to provide proper first aid care, helping that individual until medical professionals can provide medical care. The most common medical conditions in the workplace include: first, respiratory-related distress or asthma, attacks, allergic reactions, and choking are some of the most common issues you are likely to encounter. Next is heart attacks, stroke, shock, and seizures. If you are learning about the basic first aid in the workplace, it is good to find training that can help you identify these specific medical conditions. The better prepared you are, the most easily you'll able to notice the warning signs of these medical conditions. When you can recognize these warning signs right away, you can call for help immediately and administer the proper first aid care. Last is number 5. Always protect yourself. One of the most important things to remember when it comes to first aid is to always protect yourself. The only way to provide helpful, effective first aid care is to ensure that you're not in danger. Either, here are few precautions you should take to make sure you're protected before you administer first aid in the workplace. First, wear PPE. PPE or personal protective equipment should be worn to protect yourself from exposure. Examples of PPE are latex gloves, disposable masks, gowns, face shields, or even goggles. Second is do not enter if the scene is unsafe. When you assess the scene before providing first aid, you may see that the scene is unsafe. In that case, it is important that you do not enter the scene. If there is danger present, it's best to call emergency services and keep yourself safe so you do not become injured also. Last is, if there is someone on the scene with more medical training, allow them to take over. You may be able to help by calling emergency services, fetching the first aid kit, escorting emergency personnel to the scene, or helping to keep the area clear. And that's all for the 5 basic first aid tips for the workplace. And for the first aid basics for common workplace injuries will be reported by Pibeda Milrose.
Good day! Here we're gonna talk about the first aid basic for common workplace injuries. Number 1 is sprain, strain, and tears. are injuries to muscle or ligaments, the strong tissues that connect bones to each other and muscle to bones. These injuries often occur due to sudden forceful movement, twisting, or overstretching. Mga sintomas ito ay tulad na lang ng pain, swelling, or bruising or discoloration, instability or difficulty moving the affected area, and reduced range of motion. First aid. Number 1. Immobilize the affected area by using a splint or sling if necessary. Number 2. Elevate the injured area above the heart to reduce swelling. Number 3. Apply ice wrapped in a cloth for 15 to 20 minutes every 1 or 2 hours to reduce the pain and inflammation. Number 4. Compress the injured area with a bandage to minimize the swelling. Example of that, may isang manggagawa na nadulas sa isang basang sahig kung kaya't napilipit ang kanyang bukong-bukong na kung saan nagdulot ito ng pilay sa kanya. Take note, severe sprain, strain, or tears may require immediate medical attention, especially if the injury is accompanied by severe pain or swelling or discoloration. Number 2. Soreness and pain can arise from various causes, including overuse, repetitive motions, poor postures, or underlying medical conditions. Symptoms: aching or stiffness, tenderness to touch, pain that worsens with movement or activity. First aid. Number 1. Identify and remove the cause of the soreness or pain. This may involve adjusting posture, taking breaks from repetitive tasks, or using ergonomic tools. Number 2. Rest the affected area and avoid activities that aggravate the pain. Number 3. Apply heat to the sore area to relax muscle and improve blood flow. Example, an officer worker experienced neck pain due to the prolonged sitting in poor posture. Take note, if the pain is severe, persists for more than a few days, or accompanied by other concerning symptoms, seek medical attention. Number 3. Bruises and contusions are caused by impact with the object, leading to a broke blood vessels and blood pooling under the skin. Symptoms: discoloration, ranging from red to purple to yellow to green, swelling and pain. First aid. Number 1. Apply ice wrapped in the cloth for 15 to 20 minutes at a time to reduce the swelling and pain. Number 2. Elevate the bruised area above the heart to minimize swelling. Number 3. Apply a warm compress or roll a lukewarm water bottle over the affected area to help reabsorb the blood and improve the appearance of the bruises. Or number 4, over-the-counter pain relievers can help manage pain. Example of that, a worker bumps their knee against a piece of machinery resulting in a bruise. To take note, seek medical attention if the bruises is large or painful or accompanied by other concerning symptoms such as numbness or difficulty moving the affected area. Number 4 is fracture. Are breaks in the bone. They can occur due to direct impact, sudden twisting, or fall. Symptoms: severe pain, swelling, deformity or visible break, difficult moving the affected area. The first aid. Number 1. immobilize the injured area using a splint or sling to prevent the further damage. Number 2, apply ice, rough in the cloth to reduce swelling and pain. Number 3, do not attempt to realign the broken bone. And 4, seek immediate medical attention. Example of that is a worker falls from a ladder and sustain a fracture in their arm. Take note, it's crucial to avoid unnecessary manipulation of the injured area as they can worsen the fracture. Number 5 is burn. Burn are injuries to the skin caused by heat, chemicals, and electricity or radiation. Symptoms of that: redness, swelling, pain, and blister. First aid is you need to, number 1, cool the burn area immediately with the cool running water for at least 15 minutes. Number 2, remove any constricting clothing or jewelry from the burned area. Number 3, cover the burn with the clean, sterilized or dressing or gauze to prevent infection and protect it from the air. Example of that, a worker accidentally spills a hot coffee on their hand, causing a burn. Take note, never apply butter or ointment to a burn. This can trap heat and increase the risk of infections. Number 6, carpal tunnel syndrome. To make it short, CTS is a condition that affects the median nerve in the wrist, causing numbness or tingling in the pain in the hand and the fingers. It is often caused by repetitive hand movements or prolonged pressures on the wrist. Example of that, a cashier experiences CTS due to repetitive hand movements while using a cash register. Number 7, amputations are complete or partial loss of the body part, often due to accidents involving machinery, tools, or vehicles. Symptoms: severe bleeding, pain, deformity, or missing body part. Example of that, a construction worker suffers an amputations of a finger due to power saw accident. It is crucial to act quickly and seek immediate medical attention for amputations. Number 8, chemical burns and corrosions occur when chemical comes into contact with the skin, causing damage and irritation. Symptoms: redness, swelling, pain, and blister. First aid you need to do is number 1, remove the chemical from the skin as quickly as possible by flushing the affected area with water for at least 15 minutes. If the chemical is a dry powder, brush it off before flushing. Number 2, remove any contaminated clothing or jewelry from the affected area. Example of that is a worker spill a strong acid on their arm, resulting in a chemical burn. In this kind of injuries, take note the type of chemical involved will determine the specific first aid steps. Always refer to the chemical safety data sheet or guidance. Last, number 9, cuts and lacerations and punctures are often wounds that can be caused by sharp objects, tools, and other objects. Symptoms: pain, bleeding, and deformity or visible wound. Example: a worker cuts their finger on a piece of metal. the first aid you must to do is number 1, control the bleeding by applying direct pressure to the wound using a clean cloth or bandage. Number 2, elevate the injured area above the heart to help reduce bleeding. Number 3, apply antiseptic solution to the wound. And number 5 or 4, cover the wound with the clean and sterilized dressing or gauze and secured it with the adhesive tape. Take note, it's crucial to avoid removing objects from the wound as they can cause further damage and increase the risk of infection. Take note, understanding the first aid basic for common workplace injury is essential for ensuring a safe and healthy work environment. By following these guidelines, you can provide immediate assistance to injured workers or potentially minimizing the severity of their injuries and promoting faster recovery. Remember, these are general guidelines, and it is always best to seek professional medical advice for any serious injuries or if the situation is worsened. That's it. Thank you.